If you don't want to go through insurance, you don't have to have a diagnosis for sleep apnea. You do need a prescription from your physician. The amount of Daybreak devices that we sell to patients that actually have not been diagnosed went and got a prescription from their physician because they wanted to get themselves treated. This is when you start realizing, like, people are having the same realization you're having. They're like, I have a problem.
What are the biggest frustrations patients have with traditional sleep apnea treatment?
You have high blood pressure, you have type 2 diabetes, maybe you got a little extra weight around the neck, around the stomach. You know, your wife tells you keep her up all night. We've heard all of these stories. And then it's, well, what do I do? And so what Daybreak has been able to do is they started the organization with a DTC model, and that was our proof of concept. And so we went out there to patients and we said, come to us. If you're diagnosed, great. If you're not, we'll help you get diagnosed. We're going to go through a telehealth visit with you. We're going to basically do your whole health history. And then if that makes sense, we're going to get you an impression kit.
Where do you think the sleep industry is headed over the next 5 years or so?
The one thing I think we know about pharma is they're really good at marketing and getting a lot of eyes. That should be good for everybody, you know, and I think the way that we look at that is in a very collaborative way. We're actively in conversations, you know, with those kind of partners. We're really excited about what that means.
All right, we are live on the #1 DME podcast, Claim to Fame. Today we have a very special guest, Eric Mongeau from Daybreak. Welcome to the show, Eric.
Thanks, guys. It's great to be here.
Yeah, welcome, Eric. Pumped to have you.
Perfect. So I love to just we always start off with just asking a little bit about you and, like, you know, who you are and what your company does, just to get things going.
Yeah. So boy, who am I? That's a loaded question. So I've been in sleep for, I guess, going on about 16 years now. Started with ResMed as a young pup, and you know, worked up through their sales org, and you know, got to a point where I saw an opportunity that I could actually have a much larger impact by moving over to the DME side. And so I think a lot of folks go the other way. You know, you might start in DME sales or something, and you're like, I really want to go work for one of those manufacturers. That looks pretty cool. I went the other way. And I just saw that it was an opportunity for me to gain experience and learn how to run a business and help patients, you know, at like a very direct level. And so did that for the last 8 years, and then started implementing the Daybreak process actually while I was at Aeroflow, and you know, learned a lot about that and realized that this is an opportunity that I just had to go take advantage of and, you know, help other DME companies across the country, you know, to implement this process and give people options and democratize what we're doing in sleep, and all of those things were just a big part of my mission statement. And so I guess technically I've moved over back to the manufacturing side after all these years.
That's awesome, Eric. And you know, you've helped scale some of the fastest growing companies in DME and sleep, built field sales teams from scratch, and now you're leading commercial strategy at a company, kind of rethinking the entire sleep apnea treatment. So I have to ask, do you think the sleep industry is entering the biggest shift since CPAP?
Well, I sure hope so. I've got a lot of eggs in this basket. But no, I mean, it really feels like it. You know, if you walk the floor at MedTrade, you walk the floor at the sleep conference, you know, you go to Sleep Trends, you talk to people in this space. And I think that people are more open than ever to different diagnostic channels, different therapy channels. There's just so much interest here, right? We have pharma, you know, launching soon this fall. You know, we have a number of different devices. We have surgical procedures. You know, it just gives people so many more options. And I think that's what we're all looking for in healthcare, right? We're all consumers today of healthcare. You know, and I think the more that we can break down those walls and break that fragmentation, that's where so much opportunity is going to come from.
Yeah, for sure. Especially like you said at MedTrade, and you know, we obviously encounter tons of DME providers, and you know, it seems like every couple of years there's some headwinds in DME for better or for worse. So you know, it's definitely providers looking for options, and you know, that's across the board, whether it's technology to devices. So it's definitely an exciting time, and excited, and congrats on the new opportunity. I know you're relatively new there, so.
Yeah,
yeah,
I'm
awesome
whopping 8 weeks in, and it feels like it's been 2 years, but.
That's great. Yeah. No, and it's true, kind of going off what Wayne was saying. It seems like people are really opened up to, you know, trying new things, whether it's software or hardware, whatever it is. You know, people are open now to trying these new fads. And I think it's a really good thing for the industry overall. But if we're going to kind of look back at your past history, past experiences and everything like that, what were some of those like big lessons from helping grow Aeroflow during such an explosive period that you found?
Yeah, that's a great question. Aeroflow will always hold a really, really special place in my heart. I stay close to those guys. They're now a large customer of ours. So really, really wonderful people over there. And, I think one of the things that really drew me to Aeroflow back in 2019, I guess it was how they really embraced technology. And they really looked at the patient like a consumer. And they used a term that will stick with me probably for the rest of my career, which is abrasion. Their goal every day was to reduce abrasion and continues to be to reduce abrasion. And I think as an industry is if we all think about it that way, which might sound weird, right? In DME, historically, we've been really good at adding abrasion. And that's not always our fault, right? That comes from the insurance companies and that may come from, healthcare providers and health systems. And, there's a lot of places that comes from. But I think as an industry, if we think about how do we reduce abrasion and how do we demystify this process, that's where I think a lot of opportunity can come from. And then from like a scaling perspective, it's all the people. And this is such a people industry, and we're all talking about AI today. It took us, how many minutes in are we? I don't know, but we've not yet said AI, so that's an accomplishment. But we all realize that this is where we are today. We're all talking about AI all day long. We're talking about automation. We're talking about many of the technology solutions you mentioned earlier, and we're partnering with all of them at Daybreak because we see so much value in leveraging them. But this is a people industry. And we have to have great people, and we do have great people. And again, I think when we're at MedTrade or at any of the industry conferences, and you get to reconnect with those folks, you just realize, like, this is just an industry full of really, really great people. And then that's never going to change. And so for me, scaling those businesses, it was collecting as many great people as possible and finding people that, that have the same culture and the same values. And I've been very, very fortunate in my career to be able to do that.
Yeah, Eric, I couldn't agree more with the people. And I think, I always kind of knew that after years of doing this. And I think the podcast made me realize even more. I think we've released 40. I think we probably recorded like 50 or 60. But everyone is like, that was a great guy or girl. Like, that was a good conversation. And it's like, people stick around. A lot of people have been doing this. You said 16 years. I'm like coming up on 10. So it's like a lot of the same faces, but they're very passionate about the industry. Yes, so I couldn't agree more. It's an exciting time for sure. And it seems like, when you're around in the industry, you see people kind of making shifts like you did. And it's interesting to see what people's next kind of ventures are or where they land. So I couldn't agree more. There's a lot of good people. And especially as we scale, we're bringing in a lot of really smart people that are like world-class operators, but they're not from DME. And it's, a lot of them be like, Wayne, there's so many great people. Thank you for bringing me to this conference. Like, I just can't believe like everyone's collaborating so well. So that being said, obviously the people are important. What else do you think actually drives sustainable growth in DME? I know, Aeroflow had, 10x revenue that you did in maybe 5 years. What makes that sustainable instead of stalling out?
Yeah, so it's interesting. I joined the company right before COVID. And that, I think, changed many things for many people. And we used that as an opportunity to lean in even heavier into technology and automation. And so through the course of 2020, we worked with the team internally and actually automated like the entire sleep process as an example. And made it so that way for a patient that was motivated, they could get a referral from their physician. Their physician could send it over to us, fax, parachute, email, smoke signals, however they wanted to send it over. And the second it entered the building, the patient would be contacted via email and text and a voice message, and they knew that their order was received by Aeroflow, it was being processed. They could then go and get a mask fitting via AI, which then informed their cost structure. They got a full price quote from that. They knew exactly what their out-of-pocket expense was, what their expected rental was. They could make the payment, they could sign their paperwork, and they could even pick their own telehealth appointment date, all within 30 seconds. And so we were able to build a process that took what historically has been days or weeks or months in even some cases, and literally broke it down to seconds. That was a major, major opportunity, a major win. And then it became going out into the market and evangelizing what that meant. Because physicians were not super bullish on telehealth as a setup, from a DME perspective. And a lot of companies were using like free Zoom accounts during COVID and sort of just doing the best they could. We actually had already done telehealth from our trucking business for many, many, many years at Aeroflow. And so we were able to lean into a physician level telehealth platform that provided a really delightful experience to the patient. There was nothing to download. There was no passwords. There was no logins. You literally just clicked the link and you were in a waiting room and then you were engaged. And so it was our job as a team, especially as a team of marketers and salespeople, to talk to healthcare providers and explain why different was better. And my whole career, that's how I've been able to scale, is by explaining why different is better. And I think that was really a big key to that success at Aeroflow. And then being very strategic, right, about where we put people, looking for the best opportunities, and just having like a relentless drive to delight the patient. And I think that at the end of the day, if you take care of the patient, a lot of the other stuff takes care of itself. And I think most of the best companies in this industry sort of think that way. And that's always been a big part of my mantra.
Totally. And it's funny. I feel like there are usually two trends that come up on this show at some point. It's AI, like you said, and COVID. And COVID obviously played such a big part in everyone's life at that time. And it seems like it was kind of like a crucial thing, right? It was like people either made it or broke it. It was like it worked or it didn't. So some people got really, really big. Some companies grew tremendously during that time frame, and other ones just weren't able to keep up. And obviously, during that time, there's a lot that you have to keep in mind with keeping teams aligned, working with other teams, and the culture that you're building behind winning teams. What do you think like a high performing healthcare organization looks like behind the scenes to create like winning teams?
Yeah, so I'm a really bad example of this because I was scaling a company aggressively during COVID, which was almost impossible. And so I went from in-person trainings and in-person interviews to 100% virtual interviews, trying to build out a Google Classroom just to have some version of a training that we could do remotely. And I'm still very, very close with a couple of folks that we hired back then, and they joke about it all the time, how to this day they still haven't been trained yet. And it sort of was true. We all were just trying to figure out, like, what does this all mean? I think now, what I've really seen that works great is leaning into learning and development, right? Leaning into learning and development. Personally, hire for attitude and aptitude. DME is fairly obscure. And so I don't look for people with DME experience. I look for people with really great transferable experience. That could mean you were selling franchises a month before. That could mean you were a teacher. That could mean you were in pharma. That could mean so many different things. But if you have an entrepreneurial nature and you like to fix problems and you like to find solutions, you can be really, really successful in this world. And so I think, the behind the scenes, I think for the most successful DMEs today are operational teams that really are finding solutions for the patient and for the healthcare providers and for the payers. It's what I call the 3 Ps, right? The patient, the provider, and the payer. And if you're thinking about those 3 stakeholders, you can't go wrong. And it's just finding ways to bring all of that together and being like relentless in that pursuit, right? Of how do we reduce these barriers? How do we create solutions that serve all of these different folks? Some of it might be AI, some of it might be email automation, some of it may be good old-fashioned, C-suite sales relationships. There's so many different ways, I think that you can drive that growth, that positive behavior in this space. But again, I think it all comes down to looking at what are all the needs for all those stakeholders and then figuring out how you plug into those. Because this is a solutions business as well. I always tell people that this is not a product business. We love products, right? I was a product guy. When I was at ResMed, I knew every nut, every bolt, every button, every screen. That was how I sold. What I realized was once I moved to a consultative sale and I found solutions for my customers, I was so much more effective. It was no longer about where is the button, where is the bolt, how does this thing work? It's about how is this going to inform your business, right? How am I going to help you solve problems and make money? And I think once you get to that level, then you can do that with physicians. You can do that with, insurance companies. You can do that with patients. If you find solutions for people, you will be successful. And I think with those that are finding solutions and that are creating business partnerships out in the market, those are the ones that are growing really fast.
Yeah, like that. The 3 Ps. We've had a guest call it the love triangle, which always stuck with me, which is like, just explaining kind of the complexities of our industry, right? Because you're getting the person you're serving is not the person that's paying you. The person that's walking through your door was sent there by someone else. So it's, but also why there's a lot of opportunity in healthcare because it is so fragmented and, there's opportunities for people to make a big impact. And, you've worked across provider relationships, payer strategy, technology, operations. Why do you think alignment across those is still kind of so difficult in healthcare?
Yeah, well, I think it starts with our friends in Washington. The way that even just CMS and the FDA, they don't speak to each other. One sort of has nothing to do with the other. I think part of the Philips recall was very, very eye-opening. I had the opportunity to get on a number of FDA calls, and that was a fascinating experience because you really understood how the left does not speak to the right. I think our industry is doing a better job all the time, and across LinkedIn and all my social media, I see, many of our colleagues, that are in Washington and that are in their state governments. Actually, at Daybreak, I can tell you we're very, very happy and excited to let everybody know that we've already passed March as Sleep Apnea Awareness Month in the state of Massachusetts, California, and Arizona. That was an effort that we led on our own. And now we're actually hearing from all these other stakeholders in the sleep industry that want to be a part of this mission as sort of like a coalition to go out and spread the word. I think that's where a lot of these efforts are gonna make a big difference. But today the insurance model as it is, we're trying to figure out where does fee for service, meet capitation, meet value based, because capitation truly is not value based, right? It's more of a utilization management strategy. We're all trying to figure out like how do we have our piece of where we kind of fit into these things. I think it all just comes down to having those conversations though. Is if you're not talking with your payers, start today. Your payers need to know who you are, what value you add, what it is that you're trying to accomplish. Otherwise, you end up being, a line on a spreadsheet. And that could be a very, very scary place, I think, with where things are going with, TPAs and those sort of arrangements. So, yeah, I mean, I think that we're all trying to solve for the same thing, right? Which is bringing all of these pieces together, and you said it earlier. You go to the physician and you're trying to get a referral. There is typically zero financial relationship there. There is like very little sort of skin in the game from their side. That's a tough sell. But when you do that and you get that order in the building, you treat it like gold, right? You treat that patient like gold and you welcome them into your family and you realize you're an extension of the physician. And I think when you do that and you wrap back around to the payer and you show that payer that value, the payers are trying to limit the complaint calls into their call center. That is their number one goal. They want to bill as many patients through their model as they can and have as many employers sign up, and they want to limit unhappy patients on the backside. And we serve a really, really big piece of that in the DME industry. So the more that we can do that and we can keep people happy and we can get them saying really nice things about us to their payers, that's going to help everybody, in this space.
Yep. Really good perspective. Thank you, Eric.
Switch gears a little bit to where you're at now and a little bit about Daybreak and a little bit about like the backstory on CPAP. Obviously CPAP has dominated sleep apnea treatment for decades. And why do you think people and patients are now looking for alternatives?
Yeah, I think that I think we've been telling the same story for a long time. I started at ResMed in 2011. I left in 2017. And when I was hired in 2011, when I met with my boss at the time, he said that a part of your role is not about getting a bigger piece of the pie. It's going to be about making a bigger pie. We're still having that conversation today. And I think that is why I think everybody's ready for something different. We have been talking about treating this 80% of undiagnosed patients for going on 20 years now, right? Peter Farrell, founder of ResMed, used to say, this is a marathon and we're just tying our shoes right now. We are still tying our shoes. We have not even hit the start of this marathon. And I think that's why everybody is really open to these ideas. I think the recall had something to do with it. I think COVID had something to do with it. I think the global macroeconomics, that led to the limit of, chips and plastic and all the stuff that we lived through 21 and 22, all of those things have something to do with it. But Inspire is driving this messaging. ApneaMed, from a pharmacy standpoint, is driving this message. Eli Lilly is driving this message, right? The GLP-1s are driving this message. And I truly believe that a rising tide is rising all ships at this point. And I think that we all know, myself included, who now not only do I work at Daybreak, I am also a patient. I was selling CPAP professionally since 2011 until 8 weeks ago. I would never use a CPAP. I had told myself it's not going to happen. And so instead of doing another HST, I just didn't want to talk about it. And my wife would say, oh, you snored a lot more last night. I said, well, we did have that nice bottle of wine. That might have had something to do with it. But I knew something else was going on. I'm in my mid-40s now. I was like, something's going on. The day that I signed my paperwork to start at Daybreak, I went on our website and signed up as a patient, went through the whole patient experience without telling anyone at Daybreak. I have an AHI of 11. I now am successfully treated. And I've gone through the whole patient process, and I'm just blown away by the whole patient process. And I think that that's why when you look at all of these things, Lilly Direct and all of these virtual sleep clinics now that are coming around, there's so many more ways to access this care. And we talked about this when I was at ResMed from the diagnostic side. I was on the early side of home sleep testing back in 2011. And we said that if you tell the patient that they can do home sleep testing or nothing, they're going to pick nothing. If you tell the patient they can do PSG or nothing, they're going to take nothing. If you tell the patient you can do a home sleep test, PSG or nothing, they'll pick one of the diagnostics. The patient wants to have a say in their care. They want to feel like they have a decision to make. This is the same thing. If we tell the patient that you can do oral appliance, CPAP, Inspire therapy, go on a GLP-1 and do those together, go take Apnea Med and then do the oral appliance, this is going to open up a whole area for patients that a horizon we've never even seen before. And I think that that's why everyone's starting to think about this is like, how do I help more people? I've always said you need to treat 100 out of 100 patients. If 100 patients get referred for some therapy today for sleep apnea, let's find out broadly how we can get all of them treated.
Eric, having actually lived this yourself recently, it sounds like, what are the biggest frustrations patients have with traditional sleep apnea treatment?
Yeah, I mean, I think it goes back to the earlier conversation around fragmentation, right? And you go to your primary care and you say, well, a lot of times you don't say, right? You have high blood pressure, you have type 2 diabetes, maybe you got a little extra weight around the neck, around the stomach. Your wife tells you keep her up all night. The worst case is you're now sleeping in separate beds. We've heard all of these stories, right? You fall asleep at the wheel, you were in a meeting at work and you fell asleep, you're literally yawning as, your boss or your employees are trying to tell you something. Like we've heard every single one of these stories. And then it's, well, what do I do? What do I do? And I think that's really where there's an opportunity here is giving patients options from the diagnostic side and the therapy side is now helping people move through the funnel faster. And I think that that's what we're all trying to accomplish, right? Is during the recall, I think the worst I heard was 6 months. It took 6 months for somebody to get a CPAP device. That's just unacceptable. There's no way that should be that way. I mean, we need to get this to practically where it's like getting, Lipitor from CVS. It needs to be within hours or days. And I think that that's where we're really trying to all go as an industry. And again, that's all going to come down to collaborating with providers, and whether it's Daybreak that's part of a DME company and now the DME company has that as another tool in their bag, or if it's the DME company working directly with a local health system and so the data is passing back and forth through e-prescribing platforms. Like it's all about mapping out all of this communication and just making it really, really efficient. So that way when you have that patient engaged and they know they've been diagnosed with sleep apnea, you instantaneously can give them all of their options and help them find the best thing for them. And that will always be my biggest statement is like, just find the best treatment for that patient.
Yeah,
Eric,
it's
go ahead,
super
Al.
interesting. Yeah, I was just curious because I know we've kind of talked very surface level of what Daybreak actually is. And I know it's, positioning itself as fully at-home sleep apnea solution. But for anyone that's listening that's kind of curious, what is Daybreak? How does the technology actually work? Can you kind of explain that?
Absolutely. I'll get on my soapbox and you won't be able to stop me here now. So I'm very much in the honeymoon phase. So I get super excited about these things. And I was implementing this at Aeroflow. And so a big part of my role at Aeroflow was sort of bringing in all the solutions that we were working to implement through the business. And sleep very specifically, of course, was my bread and butter. And so we were deep in the process of implementing Daybreak. And the reason for that is I had been trying to do what I was just describing for years. I was always trying to figure out, how do you bring all the pieces together? And most ideally, how does everybody have some skin in the game? That was really challenging with oral appliance. I knew it was a good solution. I have a whole desk full of oral appliances here from over the years that I've tried, and I never could really figure out how to put all the pieces together. And so when I met the folks at Daybreak, I said, oh my goodness, they actually figured this out. They have put all the pieces together. And so Daybreak, the way I describe it, again, it's not about the device. Oral appliances have been around. We know how they work. They help move the jaw forward. That opens your airway. It's great for mild to moderate. In severe patients, we really should try CPAP first. And if they can't tolerate it, then oral appliance can be a good solution and often reduce their AHI by 50%. That's all the oral appliance sort of specific stuff. Daybreak is really a business solution. And so what Daybreak has been able to do is they started the organization, or we started the organization, with a DTC model, and that was our proof of concept. And so we went out there to patients and we said, come to us. If you're diagnosed, great. If you're not, we'll help you get diagnosed. Once you're diagnosed, we're going to go through a telehealth visit with you. We're going to basically do your whole health history. And then if that makes sense, we're going to get you an impression kit. The impression kit will come to your house. We'll guide you through how to do that. You do 4 impressions, 2 on the top, 2 on the bottom. You use a smile expander. You open your mouth wide open. You look very silly. You take a picture from above, from below, from the left, from the right, and straight on. And we have you answer a whole dental health questionnaire. Our teledentist then reviews all of that information. They review all of the impressions. They can see, do you have any cavities? Are you missing any teeth? You do need 4 molars to anchor the device. We look at all that kind of stuff. We knock people out if they're not appropriate for the device. We are not in the business of putting people on devices that they're not going to tolerate. From there, we manufacture the device. It's a custom-made oral appliance. They're made right in the good old United States in Oklahoma. And then we get that device to the patient. This is where some of the real secret sauce comes in as well, is now we're able to titrate the patient slowly. And so one of the big differences is if you go to your dentist is so busy, right? And their time is incredibly valuable. They typically titrate an oral appliance to 50% of maximal protrusion, which means as far as you possibly could push the jaw forward, they go halfway. For many people, that's incredibly uncomfortable. I know what it was for me when I first tried one of these devices years ago. Because Daybreak is doing this, again, at home and doing it through telehealth, we're able to move 1 millimeter at a time slowly. We can get the patient to where they get the reduction in AHI that they need to be successful, typically, in some cases, half as much protrusion as the traditional pathway. We actually just did a study about this that shows why our success rate is at 83% and why that's so high. And a lot of it's because of this titration process, because it's such a comfortable process to go to. You don't get that initial ooh, this really hurts my jaw. Most patients, it never happens at all. And so that's the model of how we work with the patient. We then were able to bring that to the DMEs. And so we now are working with all of the top DMEs nationally. We're speaking with many of the large regionals throughout the country, and we're able to bring this model to the DME. And so the DME serves as the patient identification on the front end. If you think about, again, you get 100 referrals today. Most DMEs set up about 70 to 75 of the 100. So there's 25 to 30 patients that never got set up on CPAP. We should be offering them oral appliance. In the first week, there's a subset of 10-ish% that never turn on the device in the first week. We should be offering them oral appliance. All the patients that struggled through the first 90 days of compliance, we should be offering them oral appliance. The ones that fail at 90 days, the ones that get their first resupply and never get resupply ever again, and the ones that fall off at the end of the year and just disappear into thin air, we should be offering all of those patients oral appliance. We're finding with our partners, this is roughly 55 to 60% of their front-end referrals they could actually convert into oral appliance, and the DMEs are converting at about 35% of that cohort. And the more that they get the doctors involved, that conversion number goes way up, because now the doctor understands what's happening in the process, and we coach the DMEs through that, right? We tell them the talk track. We'll go out there in the field with them. We'll work with their team. We have a whole team now across the country that's working with DMEs every single day, talking to the physicians and helping them through this process. And that's when things get really exciting, because now the doctor gets it, the DME is doing the identification, more patients are being treated, and the DME is recovering lost revenue and in a very profitable way. And so this is one of these rare things in life that's a win-win-win across the board. And again, more patients treated, get people diagnosed faster, and really getting that flywheel moving.
That's super interesting. And the reason why, one of the reasons besides for the listeners to understand how the product works, selfishly, I was thinking, every time I sleep, I can get 8 hours, and I wake up and I'm still tired. I'm like, something's definitely going on. This can't be a normal, sleep process. There has to be something happening inside that's not working right. And that kind of made me think maybe it is a sleep apnea undiagnosed type of situation. And I'm sure it's a lot of people that have that and don't know.
So it's amazing, Alex, and this statistic shocked me when I got to Daybreak. The number of patients that actually, if you don't want to go through insurance, you don't have to have a diagnosis for sleep apnea. You do need a prescription from your physician. The amount of Daybreak devices that we sell to patients that actually have not been diagnosed, but went and got a prescription from their physician because they wanted to get themselves treated. This is when you start realizing, like, people are having the same realization you're having. They're like, I have a problem. And this was me. I slept like a baby every single night. Fall asleep, drives my wife crazy. I fall asleep the second my head hits the pillow. I'm dog tired from working all day and running around chasing the kids and all that kind of stuff. And then I wake up the next morning and I have a headache and I'm a little foggy and I just feel like something wasn't quite right. Like I didn't get the restful sleep that I needed. And I was scared to take a test. And that's why I waited until I started at Daybreak to go and take that test. And sure enough, I'm in that mild to moderate category. And I think that that's the subset of folks that historically have not been a great fit for CPAP because they don't always see the immediate benefit in CPAP. They're the ones that are least likely to get tested. It's people like all of us. It's guys that are kind of in this sort of 35 to 45, 50 range, travel a ton for work, super, super busy. Oh, I don't want to cart that thing around with me. I now have my device that fits in my pocket. It's just a really, really different way about thinking about these things. And again, like, I got 2 little kids at home. I've got a wife, I've got a dog, I've got a house and a family to support. It's really important to me that I take care of my health at this point in my life. And I feel like finally I can sort of say that I'm doing that in a really meaningful way because I've actually addressed this thing that I probably knew was a problem for a while.
It's interesting, Eric, when I had this thought earlier is how do you guys think about educating people like myself, yourself, and Alex that this even exists? I actually got one of your ads recently. I'm sure you guys do marketing, and you mentioned started out kind of direct to consumer, but a lot of people don't know that this is even an option, and they probably can afford it. They're just unaware. How does Daybreak think about educating, especially people that are maybe in their 30s, they're not even thinking about sleep apnea?
Yeah, so this
or even
is
younger, it's like that's not even crossing your mind as a potential option that you have it,
Totally. And so it's funny you say like younger. We're having conversations with large groups of community colleges that they want us to screen their entire patient population and get them treated because they know those kids are never going to use a CPAP. We're talking to professional sports teams. They know that their entire roster probably has this problem, but they're never going to use a CPAP. They know they want them to be treated. There's a performance enhancement thing here that's available to them.
Totally.
We're super excited to let you know that we're actually going to officially launch in June at the Sleep Conference, but we are now a VA provider. We have a contract with a VA distributor, and we're going to be supporting our veterans at the VA. There's just so many places to be able to help people today and so many different channels to work through. And we have an incredible marketing team. Our chief marketing officer is one of my favorite people. And now that you've heard me say Daybreak for 20 times on this, it's going to be all over your social media. And the people in our social media, most of them are actually our employees. And Matt, who's one of our sales guys, who's on the phone, he actually helped my uncle through the process. An incredible guy. Garrett, he does a lot of our tech work. He's actually one of our developers. He's in our advertisements. The famous Robert Miller is in a number of our advertisements.
That's who I saw.
I saw that too, yeah.
Exactly, yeah. Wesley, our CEO, Van Morgan, our CFO. I mean, you name it. We're doing so many different things in social media and really, again, trying to get the word out, but from like a very positive way. This is not a scare tactic. I love Inspire and I love their ads because they're hilarious, but they're a little bit, poking fun at CPAP, right? And so we try to come from this like very, again, like therapy agnostic world of like, we're all trying to get to the same endpoint, which is get more people diagnosed and get more people treated. And so that's a lot of how we're trying to educate. And then again, these state resolutions, we're going to run across the entire country with these state resolutions. We will make March Sleep Apnea Awareness Month in the entire country. Come hell or high water, we'll get that done. And then we'll take it federal, and we already know that, people like Dr. Oz have a great relationship with a number of groups, in the sleep space. And there's a lot of opportunities there to tell a bigger story and to get the right people aware of what is possible. And that's what we're working every day to do. So we're doing it through our side with our team in the field. We're doing it through these partnerships with the DMEs. We'll be doing it now through the DoD and the Veterans Association. We'll eventually, be, looking at other healthcare providers, primary care, cardiologists, partnering with diagnostic groups. I mean, it's like, we can be an excellent partner to literally everyone in this space. It's just a question of like how fast we can move. And so I guess this is my plea to all the listeners, that like we want to work with everybody in this world because we just know how exciting of an opportunity this is, and we're highly motivated to get it done.
That's awesome.
That's awesome. I'm excited.
Yeah, you have a lot of cool stuff
Yeah.
going on, man. Yeah, it's that's a great problem to have. Is not like if, it's just when. How could we just scale this thing as quickly as possible and safely as possible? It's really exciting stuff you have cooking up over there. I did want to ask one final question before we move on to our rapid fire round, which is, where do you think the sleep industry is headed over the next 5 years or so?
Yeah, I mean, I hope that with all of these different modalities, and the one thing I think we know about pharma is they're really good at marketing and getting a lot of eyes. That should be good for everybody, and I think the way that we look at that is in a very collaborative way, where we're actively in conversations, with those kind of partners. And we're really excited about what that means, because I think, again, it just creates a completely different storyline in this space. And so, I think that I started in this when people were afraid of home sleep testing. I still remember calling on sleep labs, and they said, listen, if Blue Cross Blue Shield in Massachusetts goes to a home sleep testing first prior auth, we're all out of business. We will all lose our jobs. Mm-hmm. That came 6 months after I started. Not only did the sleep labs not lose their jobs, they never were busier 6 months after that prior auth went through, because they adapted and they realized that they could take night techs and make them day techs. And they could embrace 2 different forms of diagnostics to actually get more than double the throughput. These are the kind of things we've done as an industry. We've done it on the diagnostic side with sleep labs and health systems. We're doing it on the DME side every single day with the way we are implementing AI and really finding ways to help more people faster. And now we have all of these different therapy solutions. And so I think if you go to the sleep conference 5 years from now, you're going to see that everybody's collaborating with each other. They're figuring, like, every therapy has a place. Everybody feels like they're all in it together. At the end of the day, our enemy is the disease, right? The enemy is not one therapy over the other or one diagnostic over the other. The therapy is the disease. And again, if we're all thinking that way, then everyone will be successful.
Yeah, I think it goes back to, treating 100% of the patients, right? It may be one therapy or another, and the pie is definitely getting bigger, especially as people become more aware. So I love that take. I think that's a good segue into our final section here, which is rapid fire. Let us know when you're ready, Eric. Just kind of like a this or that. It's kind of the fun last segment we do on these episodes.
All right, you can tell that I'm a little long-winded, so I will do my best.
All right, maybe I'll stick to my only this or that ones. I'll give you. We'll start with this one. It can only be one word. Most overrated buzzword in healthcare.
AI.
Seat or aisle?
Oh, window.
Coffee or energy drinks?
Coffee.
Most used app on your phone?
Oh, Google Maps.
If you weren't in healthcare, what would you be doing? Keep it short.
I went to college to be an ophthalmologist, and
interesting.
I was a very nice B+ student, and all of my friends that were pre-med were, if they got an A-, they'd cry themselves to sleep, and that's when I realized I had to find something else to do.
Awesome. One thing your team would roast you for?
Probably talking too much. Or I love a good saying. I have a lot of really, really horrible analogies and things like that I like to use.
All right, last one. Let's see here. Where was the best sleep you ever gotten?
I can tell you. It's right here at my house. We have a purple mattress that I swear by. I have a pillow cube. I have a pillow cube everywhere I sleep. I have a travel one. I have one here at the house. Yeah, I will tell you, every time I come home after being away for a business trip, it's the best sleep I have.
That's awesome.
Yeah.
Well, Eric, thanks so much for joining today. It's been really, really insightful. Had a lot of cool things to tell our listeners and just inform everybody, honestly. If someone wants to get in contact with you or learn more about your business, what's the best way for them to do that?
Yeah, it's eric.mongeau, Mongeau, at thedaybreak.com. Yeah, reach out. Let's get connected. Love to.
Awesome. Thanks so much.
Thanks again, Eric. This was awesome. Have a good one.
Thanks, guys. It was fun.